Good afternoon, everyone, and welcome to VAMS for Clinics. We're going to give everyone a few moments to get settled on the line, and then we'll begin today's training session. Okay, once again, welcome to the VAMS training session for clinics. My name is Lindsay Stewart, and I'm a member of the VAMS training team. We can move to the next slide, and here I'll introduce the rest of our training team, which includes today Jenna Rowland, Shelby Keller, and Matt Menz. Next slide. So for our agenda today, we will be covering an overview of VAMS, an intro to the VAMS portals, and the end-to-end view of VAMS, of the VAMS functionality and what that workflow looks like. Then we will move into a deeper dive into the clinic portal, review all of the clinic roles, and the key tasks that they will execute in VAMS. We'll then have a sample of frequently asked questions that relate to clinic activities in VAMS. We'll start there with the question and answer portion. During that time, you can feel free to start peppering in your own questions using the Q&A pod at the bottom of the Zoom window. And then finally, we will have a live Q&A portion where we entertain and address your questions that you share with us live on the call. And then we will close out this session. Next slide. So in the beginning of our training sessions and town halls, we like to remind everyone what we will focus on during the duration of our calls. So as a reminder, we're going to focus on clinic-specific activities in VAMS, the world of clinics as terms of users and roles and responsibilities. We will not dive into policy guidance for clinics or business processes or anything like that. But we do recommend, if you have questions that come up in those categories, that you reach out to your onboarding POC or your jurisdiction POC to make sure that you're getting the right information. Next slide. So just before I turn the floor over to my colleagues on the training team, I want to give a bit of a disclaimer to everyone. Throughout this session, you will see the word consent appear in the slides that we've prepared and on the VAMS system screens itself. This language is currently under review, and updated wording will be available in future training materials and presentations, as well as in VAMS. We wanted to make everyone aware of that. In case any questions come up, stay tuned for more on consent. So without further ado, I will turn it over to my colleague, Jenna, and we will begin today's training session.
Thanks, Lindsay. So VAMS is composed of 4 portals: the jurisdiction, clinic, organization and employer, and recipient portal. Within each portal are its users. And as you can see, we've spotlighted the clinic portal on this slide. The clinic portal has 4 users: the clinic administrator, inventory manager, front desk person, and healthcare professional. Next slide, please. So this is the VAMS workflow. This workflow shows how the 4 VAMS portals and their users interact with each other. There are a series of activities that each user will engage in that will trigger or allow an action on the part of another VAMS user. For example, the first step for everyone to start using VAMS begins with the jurisdiction point of contact, adding clinics and organizations or employers in VAMS in order for them to activate and register their accounts. In VAMS, an organization is any institution, association, company, or other group that will add critical infrastructure workers and other at-risk groups in VAMS to be considered for COVID-19 vaccination. An employer is one example of an organization. We use the term employer coordinator to indicate the person within an organization who will be serving as the point of contact for the jurisdiction and adding workers into VAMS. By adding clinics into VAMS, this allows the clinic point of contacts, which will likely be the clinic administrators, to set up their clinic operating hours, vaccination stations, place inventory requests, and add other clinic users in VAMS so they are prepared to administer COVID-19 vaccination to the recipients. This also allows employer coordinators to register their organization in VAMS and either add employees in the system themselves or request the jurisdiction point of contact to authorize policy-enabled registration. After the employer coordinators have added their workers or volunteers in VAMS, those workers become vaccine recipients and receive a registration email prompting them to complete the pre-screener, add their medical information in the system, and then schedule an appointment at one of the vaccination clinics. When the vaccine recipient arrives at the clinic, a healthcare professional will administer vaccine. Next slide, please. So now that we've reviewed the VAMS workflow, let's get started with our demo. Today, I will be serving as Kim Jones, the jurisdiction point of contact for the state of Michigan. And as a jurisdiction point of contact, I was added in VAMS by CDC and received a registration email from vams@cdc.gov. So as I said, the first step for everyone to begin using VAMS is for me, the jurisdiction point of contact, to add clinics and employers in VAMS. And I've been reaching out to clinics and employers and organizations in Michigan and have most recently heard from Kiera Copeland, the clinic administrator for the Highland Clinic in Highland, Michigan. I'm going to add her clinic in the system by adding the clinic's name and address, Kiera's name and email address, and select her clinic's type. This will allow her, as the clinic administrator and point of contact, to activate her account and register her clinic so she can begin setting up the clinic schedule, which she will show us how to do today. I've also heard from Matt Smith with IIS Frontline Workers 2 weeks ago. He's an employer coordinator whose organization has critical infrastructure employees he wanted to add in the system so they can become eligible to receive COVID-19 vaccination. I added IIS Frontline Workers as an organization in VAMS by entering their name, the employer coordinator's name, which was Matt, and his email. Once he did that, he began adding employees in the system so they could register as vaccine recipients. One of those employees, Naomi Russell, has already registered as a vaccine recipient. And today, the healthcare professional at the clinic where she scheduled her appointment will be showing us how they will log Naomi's vaccination in VAMS. So now that I've added a clinic and organization in VAMS, let's transition over to Highland Clinic, where I will also be playing the role of Kiera Copeland, the clinic's administrator, and I will show you how I'm going to set up my clinic in VAMS. So as a clinic administrator and point of contact for my jurisdiction, I will use VAMS to set up my clinic so it appears for recipients when searching for a clinic to select and schedule their vaccine appointment. After activating and registering my clinic in VAMS, I will follow the steps shown on the screen, which are also outlined in the clinic administrator user manual. My first task will be to set up my clinic schedule, which I will do by performing steps 1 through 3 on this list. Then I will add my clinic staff, my inventory manager, front desk, and healthcare professionals as VAMS users. Then once I've done that, I will show you how to view the help page in case I need support or have any questions when I'm done. So now I will share my screen to show you the email I received from CDC. Okay. So because my jurisdiction point of contact made me the clinic's POC in VAMS, I received this email with a registration link that I'm going to click on that will allow me to activate my account and register my clinic in VAMS. So I'm going to click this link here. This will take me to the login page. Let's see. Let me try this one more time.
Yes, Jenna, I can explain this. For some of you that you already know, we are doing some upgrades to the system and pushing out some new functionalities, including dashboard functionalities and other. And
Okay.
I believe this is impacting what Jenna is trying to show to you. But I will.
Let's see here. Maybe I go into UAT, try to get into the system. Let's see, I need to log out.
Yeah, can you open it?
Maybe that was the problem.
Yeah, can you try opening in an incognito window because your sessions are overlapping in the same browser?
It worked. I think I just needed to log out. So my apologies for that. So on this login page, I'm going to create my password. And then I'm going to look in my email, my inbox, because the second I click the registration link, a two-factor authentication code should have been sent to my email account, and it was. So 622198, I will enter that. I will review this information here and click that I agree to the terms, and I will click create an account. So after I have activated my account, I will immediately be taken to the registration page. I'm going to review the information that is on this page. If there's any updates I need to make, I can do that. But this looks good, so I'm going to click next. And then on the clinic information page, I will confirm that my clinic's information is correct. So the clinic type, the jurisdiction point of contact selected was clinic, because mine is a standard clinic, which means it is in a healthcare setting providing outpatient care and one that has a permanent location for vaccination. I can find information about other clinic types in the clinic administrator user manual. So the clinic's primary and shipping address can be different if I would like vaccine to be shipped to a different address. But I want it to be shipped to the same address, so I'm just gonna keep clicking next here. And finally, on this page, I will review all information about my clinic and VAMS. If everything is correct, then I'm going to click this checkbox down here, saying that I confirm that all of the information is accurate. If I see that I need to make an edit to any of the information in here, I can always click the previous button and return to the previous pages. Everything looks good to me, so I'm going to click next. So now that I've completed that step, my clinic is now active, and I'm going to start building my clinic schedule. So I'm going to click this button, this view portal button that will take us back to the home page, but I could also click the logo up here in the upper left hand corner to return to the page as well. So to set up my schedule in VAMS, I will primarily be focusing on the clinic details, clinic setup, treatment stations, and clinic absences tab. On these tabs, we will be completing all steps needed for our clinic to appear to recipients in order for them to schedule appointments. So one easy way to think about setting up the schedule is that it's as easy as 1, 2, 3. Setting the appointment duration, set the operating hours, and set up the treatment stations. So as my first step in setting up the clinic schedule, I will set my clinic's appointment duration by clicking on the Clinic Details tab. I will click the Edit button in the top left corner of the screen. I will scroll down and I will select an appointment duration from the appointment duration field drop-down menu. These can be 10, 15, or 20, or 30 minutes long for appointment durations. This selection will apply to all treatment stations within the clinic and will determine how many appointments are available at each treatment station each day of operation. Before making this selection, I'm going to keep in mind that the appointment duration should include time for patient intake, vaccine administration, and some time to reset the station for the next appointment. So for example, if I select a 30-minute appointment duration, the appointments will be scheduled from 9 to 9:30, 9:30 to 10, and so on, with no buffer time built in otherwise. So I'm going to select 30 minutes as my appointment duration. I will point out here that on the Clinic Details tab, I can update my shipping address for my inventory, or I can deactivate my clinic by clicking this button here in the bottom right corner. But I'm ready to go and keep setting up my schedule, so I'm going to click Save. So now that I've selected an appointment duration for my clinic, I'm going to set clinic operating hours, which include days and hours I want the clinic to be open for recipient appointments. Again, this along with the appointment duration and number of treatment stations I set up at my clinic will determine how many appointments my clinic can accommodate each day. So to set my operating hours, I will click the Clinic Setup tab. To edit my clinic's record, I will click my clinic's name here. Then I will click the Edit button located in the upper right-hand corner of the screen. So let's review this Edit clinic location record here. We're going to start at the top and work our way to the bottom. So this available for scheduling checkbox will automatically be checked. And basically what this box is asking us is if we want our clinic to be available for scheduling. If I'm ready to receive, to start having recipient appointments, I will leave this checked. If not, I can uncheck it and come back to this page later to check it when I'm ready. But I'm ready to start receiving recipients at my clinic. So I'm going to leave this checked here. We see our clinic's address, which can be updated here if necessary. And then we come to the time zone. So it's important for me to check this and confirm it's correct. Because if your jurisdiction sits across multiple time zones, it's incredibly important to ensure that I check this and make sure it's correct. Otherwise, appointment times could populate in the wrong time zone. Then we come to start and end dates here. The clinic start date will auto-populate to today's date, which we see here. I need to add an end date for my clinic to determine the last date appointments can be scheduled. For now, I'm going to schedule a date a few months in advance here, and I'm going to have an end date of January 29th, 2020. Again, I can come in and edit this at any time. I see we have these clinic operating hours here in this field, and I'm going to edit those in a second, but I'm going to leave this all here for now. And then I'm going to click Save. Okay, great. So if the changes that I've made don't populate here, don't worry, it has all been saved. I just need to click the refresh button here and all of that information will appear. There it is. Okay, so now I'm going to click this link below Clinic Operating Hours field. On this page, I can edit the name of my clinic operating hours by clicking the pencil icon here. And I'm going to name these my Highland Standard Monday, Wednesday, Friday hours. Because my clinic is going to be open Monday, Wednesday, Friday. So that's what I'm going to name these hours. So I'm going to click Save. And then I'm going to click this Operating Hours tab. From here, I need to start adding time slots for each day by selecting the day of the week and then a start and end time for each time slot I'm adding. So I'm going to click New. I'm going to click this New button here. I'm going to select the day of the week, So I'm going to set up my Monday hours. So my start time is going to be 9 a.m. and I want to end at 4 p.m. Okay. So if I was only adding one time slot, I could just click save and get out of this window. But I need to add the hours for Wednesday and Friday. So I'm going to click save and new so that another pop-up screen here will appear so I can add my hours for Wednesday. But on Wednesdays, I don't think I'm going to have enough healthcare professionals to cover rotating for lunch. So I'm going to do this. On Wednesday, I'm going to select 2 time slots here. I'm going to set this up so that we are open from 9 a.m. to 12 p.m. I'm going to click save and new. And then again, on Wednesday, I want to set up another time slot because I want everybody to be able to eat lunch from noon to 1. So the start time for this time slot is going to be 1 p.m. to 4 p.m. So I'm going to click this actually for now. So we see that we have these 2 time slots on Wednesday, from 9 to noon, then we'll be on a break from 12 to 1, and then it will reopen from 1 to 4. This will impact the number of appointments that recipients will see as available on Wednesdays. So they will not see an appointment as available or any appointments available between 12 and 1 on Wednesday because I've set these operating hours this way. So now I need to add a time slot for Friday, and we're going to set this as 9 a.m. to 4 p.m. Okay. So now we have our operating hours for our clinic right here. Okay. So before moving on to my third step, I do want to point out one thing here, which is setting clinic absences. I can do this by clicking the Clinic Absences tab. So if there's a day of the week, such as a holiday, where the clinic will be closed, I can set a clinic absence here. During a clinic absence, the system will show your clinic as closed and appointments will not show as available to recipients. If I create a clinic absence during a time when recipients have already scheduled appointments, those appointments will be canceled and the recipients will receive a cancellation notification via their preferred communication method. To set an absence, I have come into this Clinic Absences tab and I'm going to click the New button. So here I'm going to click in this field and I see my clinic here to select. I'm going to name this Thanksgiving because I want my clinic is going to be closed for Thanksgiving. So this is a federal holiday. That's my absence reason. So the start date is going to be the 26th, which is Thanksgiving, and the end date will be the 26th as well. I'm going to click save. This is giving me a notice that reminding me of what I just shared with you, that any appointments that were already scheduled during that time period will be canceled. I'm going to click save again. So all clinic absences will appear here in the clinic absences table. And from here, I can edit or delete any of them by clicking this and hitting edit or delete. So now let's move on to my final and third step in setting up my clinic schedule, which is to add vaccination stations. So vaccination stations are called treatment stations in VAMS. I'm going to click this tab. So setting up treatment stations allows you to have multiple vaccination appointments occur at your clinic simultaneously. I must set up at least one treatment station at my clinic for appointments to show as available. And some key information about treatment stations are that I will set up vaccination stations or treatment stations based on the planned number of healthcare professionals I will have on staff. So for example, if I plan on having 2 healthcare professionals staffed at my clinic, then I will create 2 treatment stations. Vaccination station hours will automatically default to clinic operating hours unless I want to set unique operating hours for each treatment station or stations. Treatment stations, along with the set appointment durations, are what dictate the number of appointments available for recipients to select from when scheduling an appointment at my clinic. So since I have 2 healthcare professionals on staff at my clinic, I'm going to create 2 treatment stations. So I'm in here on the treatment stations page. I'm going to click the new button. In this field, I'm going to select my clinic. And then I'm going to name my treatment station, something that will be easy to differentiate it from the other treatment stations I create. So I'm just going to name this station, Station 1. The start and end dates will be whatever I select and however long I expect this treatment station to be opened. So for now, I'm just going to select the same date that I selected for my clinic, January 29th. And then I want this treatment station to adopt the operating hours I just created for my clinic. So I have to name these by clicking this new treatment station or new operating hours. I'm going to name these default operating hours, just so I know that this station is using my clinic's operating hours. So I have to name these, but I don't need to set up any time slots or operating hours for this station because again, they're going to be adopting the clinic operating hours. So I'll click Save. And now I am on the treatment station details page. Now, I have need to add one more station. So I'm going to click the logo to return back to the portal homepage. Going to treatment stations, and I'll click New. So this is going to be my second treatment station. So I'm just going to name this Station 2. And so I want this treatment station to have different operating hours because one of my healthcare professionals can't work on Wednesdays. So I'm going to need to set up some different operating hours for this treatment station. So I'm going to select the same end date as the other one. And then I'm going to create new station operating hours. And I'm just going to name this Station 2 operating hours. And I'll click Save. And then I will click Save again. So on this station details page, I'm going to come down here to this link and click here under Station Operating Hours. And this is going to function similarly to how it did when setting up the clinic operating hours. So I can come here and I can rename these operating hours if I'd like, but I'm going to leave these because I like this name. I'm going to click the Station Operating Hours tab. And so I'm going to click New to create time slots for these operating hours for this station. So again, this healthcare professional can work from 9 to 4 on Monday. So I'm going to have the same hours as I do for the operating hours for my clinic. And I'm going to click Save and New. And here, since she can't work on Wednesday, I'm going to click Select Friday. I'm going to have the start time as 9 a.m. and 4 p.m. is my end time. So I'm going to click Save. So now this treatment station has operating hours on Monday and Friday only. So from here, I want to point out how the operating hours I've set for my treatment stations will always be overridden by my clinic's operating hours. So if I had made a mistake in this treatment stations page here, and I had selected the operating hours for that station to to go until 5 p.m. as the end time for Friday, the clinic's operating hours will override this and will not show appointments as available to recipients beyond 4 p.m. So moving on. So we also can come into the treatment station and add treatment station absences. So if I have a healthcare professional who will be going on vacation and taking off certain days, then I can create a station absence, just like I did for the clinic operating hours or the clinic absences. And that will remove those time slots as showing available to recipients who schedule an appointment during that time or that day. But none of my healthcare professionals are have any planned holidays or time off for now, so I'm going to move on from here. So speaking of healthcare professionals, I'm going to move on to the next step in setting up my clinic, which is adding clinic staff as VAMS users. So I'm going to click here, the Manage Users tab. Adding clinic staff and managing their status in VAMS gives them access to perform their role in the system. The clinic user roles generally align with each user's existing scope of responsibility at the clinic. So as the clinic administrator, I can assign multiple user roles to one user, giving them access to perform additional tasks in VAMS. Prior to assigning multiple roles to clinic staff, I reviewed the VAMS roles and activity matrix in my clinic administrator user manual so that I am familiar with the different roles and their access in VAMS. The most important to note is that the healthcare professional role must be assigned only to healthcare professionals because they have access to view recipient personally identifiable information, or PII. Assigning a healthcare professional role in VAMS to a non-healthcare professional is strictly prohibited. To add VAMS users for my clinic, I've clicked the Manage Users tab, and now I'm going to click the New button. Here, I'm going to add somebody from my front desk. Her name is Cassie Smith, so I'm going to type in her email address. Okay, and I'm going to click Search. Okay, so let me add Cassie's name. And I'm going to select her role here. So these are all the available roles for her. She's going to be my front desk person. So I'm going to click that and then click this arrow. You can see here that I could also add another role to her responsibilities, such as an inventory manager, but I'm going to just leave her as front desk for now. So I'm going to click that and move it back into the available roles. If she were a healthcare professional or had other credentials, I could come down here and select this and add it to her list of credentials. But this looks pretty good, so I'm going to click Save. Okay, so now I'm going to add my healthcare professional here. So I'm going to enter his email address. I'm going to click Search. And now I can see when I've clicked Search that Tyrone Williams, my healthcare professional, is already a registered user in VAMS. And I can see that he is a healthcare professional and he is an MD. So another clinic administrator has added him in the system prior, and she has added them, or he has added Tyrone as a healthcare professional. Now again, I can add additional roles to Tyrone's responsibilities, but what is important to note is that when I do that, those roles also will convey to whatever other clinics he works for. So if I were to add inventory to his roles, his responsibilities in VAMS, then any other clinic that he is registered as a healthcare professional, he will also be an inventory manager. He will also have access to that part in VAMS. But I don't want him to be my inventory manager, so I'm going to remove him. His credentials look correct, so I'm going to click Save. So after I've clicked Save, a registration email will be sent to both of those users that include a link to set up their account in VAMS. I can come in here at any time and edit a VAMS user record by clicking on their name and either clicking Edit, or I can remove them from the system by clicking this button. I don't want to do that just now. Okay, so that is my final step in setting up my clinic. But now I'd like to talk about inventory management. So I'm going to share this here. So as a clinic administrator, I, along with the inventory manager, have access in VAMS to place and track inventory requests, log inventory and waste, as well as monitor vaccine inventory levels. So we will go back into VAMS here and do that. So the inventory request page right here will show me a list of all inventory requests I've submitted. This list will include a system-generated inventory request number, the clinic name, product type, the date requested and required, and the number of doses requested as well. So to place a request, I'm going to click the New button here and see this Site Inventory Request page. I'm going to click in this product field and start searching. So I would enter something like COVID and see all the results that pop up here. So I'm going to select this one here, the vaccine name. I'm going to click this number. And then I'm going to enter the number of doses that I want. I'm going to say I want 200 doses. And then I'm requesting this today. And I'd like to receive these in a week. So I'm going to click Save here. So my jurisdiction point of contact told me that she's responsible for placing all COVID-19 vaccine inventory orders outside of VAMS. And in some circumstances, the full number of doses I've requested may not be immediately available for fulfillment. So after my inventory request has been sent, a record of that request will appear on the inventory request page as shown here. So this inventory request record I will access by clicking this number. Gives me really important details about the inventory request I just placed. And it will also allow me to monitor the request and communicate with the jurisdiction POC about it. So on the left-hand side here, I can see all of my request details. Clinic address, when it was requested, and when I requested to receive those doses, how many I requested. On the right side is where I could send the jurisdiction point of contact a message by typing in this box here. And I could say, please update me on my request at your earliest convenience. And then I would just click share. So now that I've sent that message, I can click the follow button. So when the jurisdiction point of contact responds to my message, I will receive an email notification saying that they have responded. So now that we're done with that, I'm going to move into how to log inventory once I received it. So when I receive the COVID-19 vaccine inventory, I'm going to click on the Inventory Management tab, which is the default homepage here for the clinic portal. So I can log vaccine inventory one of two ways. I can manually enter the information, or I can use a 2D barcode scanner to scan the barcodes on the vaccine vials. So VAMS is compatible with 2D barcode scanners, including Bluetooth wireless and those that are not wireless. On my inventory management page, or excuse me, on my inventory, the barcodes that I will see are the unit of use, or UOU, located on the vaccine vial, and the unit of sale, or UOS, located on the packaging in which the vaccine vials are delivered. So as an example, one box or unit of sale, I could receive 10 UOUs or vaccine vials. So let's review logging inventory by using a 2D barcode scanner. I do not have a 2D barcode scanner, but if I did, I would click the scan inventory button here. And when this pop-up appears, I would scan the UOS barcode on the vial with my scanner. The barcode will appear in the UOS barcode field, and I would select the manufacturer here. But since I don't have the barcode scanner, we're just going to log our inventory manually. So I'm going to just go back here, and I'm going to click the manually log inventory button instead. So I will select the manufacturer. Let's see. And I will select the product numbers. So this manufacturer here pre-populates based on the order that I have, or the request that I placed. So I'm going to select that same manufacturer, and based on that, the product will default to the product that I ordered. I'm going to enter this UOS lot number. We'll enter the UOU, or the vial lot number, and the total UOUs in the UOS. So I'm going to say 10. The expiration date, I will locate on the vial and select here. There we go. Okay, then I'm going to click next. Okay, I'm going to review this information, make sure everything I've entered is correct, and then I'm going to click next. And now I'm done. So I've logged my inventory successfully. Click finish. But now I see that one of my staff members has broken one of the vials. So I need to log vaccine waste. So I can do that in the similar manner and on this page. I can either log waste by scanning it using the 2D barcode, or I can manually log it. But since I don't have a 2D barcode scanner, I'm going to manually log waste. So this pre-populates also based on the inventory you have loaded into VAMS for your clinic. So I will select the manufacturer, I will select the product, and then the lot number that I entered when I entered my inventory will populate here. The expiration date will auto-populate as well. And there are multiple reasons we could select for wastage, but one was broken, so I'll leave that there. And I'm going to say that 2 doses were wasted. So I'm going to click next. We'll review that information. If I've made a mistake, I can always click the previous button to return back to previous pages. But this looks good, so I'm going to click next. And I will click finish. So as you can see, on this page, I can see the number of appointments scheduled at my clinic over the next 28 days, including today, which none have been scheduled yet, of course. And then the total of on-hand inventory doses. see. So the total on-hand inventory data on this page comes from the inventory that we've logged, the waste that we've logged, and then what the clinic healthcare professional logs during vaccine administration. All of this data logs automatically and updates these numbers automatically. So the final thing I will show you as a as a clinic admin and inventory manager is the help page. So I'm going to click this link in the upper right-hand corner. I have a question about which browser I should be using when logging into VAMS. So I'm going to come here and I'm going to ask that question. But all clinic users will have access to this help page where they will find frequently asked questions about their access and activities in VAMS. So I can scroll through these questions, or I can type in a topic to narrow it down. So let's see. Oh, we don't have anything about browsers. I will type in inventory. Okay. So obviously, moving forward, this will be populated with a number of frequently asked questions, which actually we will review some of them today. But there will be lots to choose from. And when you type in a search topic, it will narrow down those FAQs so you don't have to scroll through all of them. So that completes my clinic administrator and inventory manager duties for today. Let's transition over to JJ, the front desk personnel at Jefferson Clinic. She's going to show us how to check in a recipient.
Thanks, Kiara. So like Kiara just mentioned, today I'm going to serve as JJ O'Connor, our front desk staff member for the Jefferson Vaccination Clinic. So I will be checking in a recipient manually by validating their identification and that they completed their vaccine questionnaire. And I will also create a walk-in appointment and view a recipient's appointment status. So if we switch over to VAMS here, I'm currently logged into the clinic portal as JJ O'Connor in our Jefferson Vaccination Clinic. You can see that my only tab here as a front desk staff member is the recipient check-in tab. So by default, I see all of today's appointments, but if this dropdown lets me view by other appointments as well, which you can see here. I can also create a walk-in appointment if my clinic allows walk-ins, but even walk-in recipients must be registered in VAMS, and that's to make sure that they've been validated with an employer so we know that they're most likely eligible to get the vaccine. So to create a walk-in appointment, I'm going to click this Create Appointment button, and it will ask me for the recipient's email to search. So I'm going to put in a recipient here, this guy, and click Search. And I can see here that Emmanuel has no scheduled appointments currently. So I do have the option to go ahead and create an appointment for him. If he did have an appointment at another clinic, I would see that here and I would see an option to cancel that appointment and create a walk-in at my clinic instead if he wishes to do that. But since that's not the case, I'm going to go ahead and schedule his walk-in. And now we can see his appointment has been created successfully. And here's all of his appointment information. So if I go back to the clinic portal and try to check him in here with check-in recipient in today's appointments table, I will see that he has not yet completed his form. And this makes sense because I just created the appointment. So at this point, I would tell him to go check his email for this form and complete it. And once that's done, I could finish his check-in process. I'm going to click Finish here. And I know that Naomi here has already completed her form, so I'm going to check her in instead. And you can see that validation here that she has in fact completed her vaccine questionnaire form. And I will just double check all of her information here against some form of identification if required for my clinic. So if no ID is required, that is an option here where you can see no ID required for this clinic, and I could select that. And these ID requirements are just based off of jurisdiction policy, so they will vary. But if ID is required, but the recipient doesn't have a valid form, I would select this last option, required but not provided. And this would cancel her appointment and require her to then reschedule and come back when she does have a valid ID. But let's say for today, she gave me her license. So I will say she gave me a state or federal issued ID. And everything looks great and it all checks out. So I'll click next. And now it takes me back to this page, and I can confirm that she is checked in by clicking this view appointment button here. And I see her status here is in fact checked in. So now that she's checked in, I am going to switch over here. I'm going to log out as our front desk. And I want to show you our healthcare professional role. And I'm going to switch into this role now. So I'm going to serve as Tyrone Williams now, who is a clinic's healthcare professional for the Jefferson Vaccination Clinic, which we saw Kiara bring up earlier. So I'm going to walk through viewing the recipient record as the healthcare professional, which includes looking at their vaccine questionnaire, the recipient details, their medical information, and then actual vaccine administration, as well as any alerts or notes if they're applicable. And then I'm going to walk through actually logging a vaccination, including the vaccine information, the outcome, any waste, and communicating the next dose eligibility to my recipient. So let's switch back to VAMS here and go ahead and log in as Tyrone, a healthcare professional. I'm just going to enter my email and password and do my reCAPTCHA here for extra security. Click login, and then I need to go to my email to find that verification code. I'll copy that here, paste it over here, and verify. So I happen to see multiple clinics here because I serve in various roles at these different clinics. They have all these clinic admins have added me in different roles. So today I'm going to use the Jefferson Vaccination Clinic. So I'll click Access Portal here. And as the healthcare professional here, my homepage just has one tab, which is Manage Appointments. And from this page, my default view is today's checked-in appointments, but I can use this dropdown and view by checked-in recipients, and that will display all checked-in recipients regardless of the date of their appointment. So to begin the vaccination administration process for Naomi, who we just checked in here, my first step is to access her record. So I'm going to do that by clicking her name. And then this next screen that appears is a confirmation asking, have you verified that this is the correct recipient? To remind me to verify the recipient's identity by confirming their name and date of birth. I'm going to say that yes, I have done that, and click next. And now we see her full recipient record. So starting up here at the top, there is a notes section, and that's where I can log any information about the recipient that may be helpful to another healthcare professional in the future. For instance, if I experience today that the recipient seems nervous about needles, I could go up here and click New Note. I could title the note, enter it in here, and save it. But I'm not going to do that just yet since I haven't administered her vaccine yet. So if there were any alerts, then those would appear here below the notes section. So if the recipient reported any information about their medical history that's important to review prior to their vaccination, that would show up here. If they haven't reported anything of note, then there will not be any alert here. You can see once again confirmation that she completed her questionnaire. And on this first tab here, I see that confirmation, and then I also see information relevant to today's appointment, such as any allergies, current medical treatment, the health of the patient today, and so on. So I want to review all of that. And then if I click over to the Details tab, this gives me all the recipient's personal information, name, gender, race and ethnicity, address, and contact information, including any emergency contact if they chose to put that in when registering. Then on the medical information tab here, this is information that the recipient entered upon registering in VAMS. So this also includes any medications, health conditions, known allergies, and then any insurance information as well if provided. So then our last tab here is vaccine administration. And this is the most important tab as the healthcare professional, one of the most important tabs, because this is where my log vaccination button is. So since I have now gone through all of these and reviewed her information and assessed her current condition, I am going to click Log Vaccination. And it's going to ask me these two questions here. So based on the recipient's current condition and medical history, should the vaccine be administered? I'm going to say yes, it all looked great. And then, has the recipient consented to receive the vaccine? And we saw that she did complete that questionnaire. So I'm going to say yes there as well, and then click next. So now I'm on the enter vaccine information piece, and I have two options to do so. I can either scan the UOU or vial barcode if I have a 2D scanner, or I can enter that information manually. So since I don't have a scanner, I'm going to enter manually. And first I'm going to select the manufacturer here from a dropdown. And I want to note that the vial information is checked against inventory that exists in the system. So based on vaccine inventory already logged in the system, the dropdown selections for these next two fields will be dependent upon this manufacturer that I selected. So now that I've selected that, I'm able to select a product and then a lot number. And again, the expiration date on this is pre-populated and cannot be edited. So then I'll click next. Now on this screen, this is a summary of all the vaccine information entered for me to review and a field to select the vaccine administration site. So for instance, I can say we're going to use her left deltoid today. And then I'll click next. At this point, I would administer the vaccine and then come back and say, was it successful or not? So today we are going to say that it was successful, but if the vaccine administration was unsuccessful, you would select no, and then the system would prompt me to determine if it's possible to reattempt vaccination. So more information about how to log an unsuccessful vaccine is found in the healthcare professional user manual. So for today, we're going to say it was successful. And that will take us to our next step, which asks, was any inventory wasted during the appointment? So if wastage occurred, you would of course click yes, and then you would be prompted into the record wastage section. And you can log vaccine wastage information by following the same process that you follow to log vaccine information, either entering it manually or by scanning the barcode. But today we're going to say no wastage occurred and proceed. So this is our final screen here that says the vaccination was successful. So as the healthcare professional, I've completed my process here, the vaccination process for this recipient within VAMS. So I see here that this tells me the recipient will be eligible for the next dose of their vaccine on or after November 27th. So the vaccine data entered into the system determines the date that the recipient is eligible to receive their next dose, and VAMS does not allow the recipient to book an appointment before that date. So VAMS will send a notification to Naomi here, our recipient, that includes her next dose eligibility rate, as well as a link to schedule her next appointment on or after that date. If no further doses were required, then this window would state that all COVID-19 vaccine doses have been administered. And now I will inform the recipient that she can access her vaccination certificate from her recipient portal in VAMS. And I can also view the vaccination certificate here by clicking this hyperlink text. And then I see it right up here. And I could always see this again by coming back to her recipient record. So that concludes my demo of the healthcare professional role in our entire clinic demo for today. So I'm going to pass it back to Matt to address some frequently asked questions.
Thanks, Shelby. Now let's jump in and talk through some frequently asked questions about the VAMS clinic portal. We've identified these questions as relevant to clinic users from previous VAMS training sessions with jurisdiction points of contact. If you have additional questions, please enter them in the Q&A pod. Okay, first up, is there an electronic signature for the provider administering the vaccine? Yes, healthcare professional VAMS accounts are associated with their email address and includes their full name and credentials. Therefore, healthcare professional full name and credentials are linked to every recipient to which they administer a vaccine. CDC can see the name and credentials of all healthcare professionals who administer each vaccine dose. Can I use my clinic staff account to request a vaccination appointment for myself? Yes, you can use your clinic staff account to request a vaccination appointment in VAMS by following these steps. First, you will request that your jurisdiction point of contact adds your clinic as an employer in VAMS. Once that is done, you will receive an email to register your clinic as an employer, and you will be listed as the employer coordinator for your clinic. Once you have set up your clinic as an employer in VAMS, you will be able to add employees as recipients in VAMS. Add yourself as an employee. After adding yourself as an employee, you will receive an email from VAMS with a link to register as a recipient. This email is sent to the same email address you used to log into VAMS. Follow that link to complete your recipient registration. Once your registration is complete, you can schedule your vaccination appointment. Please note that you can find detailed instructions to complete these steps in your Clinic Administrator User Manual. Can clinics limit who see their clinic information? Meaning, can clinics limit which recipients can schedule appointments at their clinic? Standard clinics and mobile clinics, such as hospitals, pharmacies, and pop-up clinics, cannot restrict which recipients can view their clinic information. Third-party clinics, such as long-term care facilities, are not visible to recipients, and users outside the clinic cannot search for them. Third-party clinic administrators and select clinic staff are responsible for uploading their own list of recipients, administering vaccine as part of the normal course of care, and documenting when vaccine is administered. How many treatment stations can I set up? You can create as many treatment stations as you need to run your clinic. How do I view my dashboards or inventory details? On the Inventory Management tab in VAMS, you can view inventory details. This page gives you a complete view of important information about your vaccine inventory level. Does VAMS update inventory in real time? How is inventory accountability reported back to the IIS? VAMS updates inventory in real time and includes all vaccines administered and/or documented as wastage. VAMS does not currently reconcile inventory with the IIS. Inventory is decremented at the point of vaccination. This concludes our review of VAMS frequently asked questions. I'll now hand it over to Lindsay to review questions from the Q&A pod.